I've been asked to summarize one of my research projects in under 2 minutes, so I'm doing a practice run with you wonderful people to see if it fits in the allotted time. So here goes. Who are you? If I asked you this question, most people would respond with a story. And this is not just an anecdote. In a very real way, our identities are made of stories. Stories that we tell about ourselves, stories that we tell about each other. And these stories that make us who we are, they can be really damaged and hurt by disease. You're just chugging along one chapter following the next, and then bam, it's like a train being derailed. And it can be really hard work to find rails again, to reconstruct a narrative, a story of who we are with the disease in it, either as a chapter or as part of it from now on. Unfortunately, health systems and hospitals do not help us with this task. Of course, you tell your story to a bunch of healthcare professionals, but it's usually not the same kind of pieces of your story that you would tell if you were asked who you are. And in the course of a hospital stay, your story can sort of get lost. So the project I want to tell you about is a collaboration with a team in the Italian-speaking part of Switzerland. A few years ago, a surgical team there started asking patients who were coming in for elective surgeries for a small autobiography, a short document with a few questions to guide them in this writing. This was optional, but the overwhelming majority of them accepted with gratitude and relief. They knew that hospitals were not good for our personal stories. Together with this team of surgeons, we got authorization to do an analysis of a sample of these autobiographies with qualitative tools and also literary tools. And we are learning a lot about how patients entrust their stories, what they expect of healthcare teams when they do that, and what role this plays in the healthcare provider-patient relationship. Yeah.